welcome to the show. As always, it's a great pleasure to have you with us. Now, tonight on the show, we host Dr. Teguest Guerma. She is the Director General of AMREF. She shares her insights on leadership, development, and health on the African continent. You get to have your say on the issues, and we have Africa's top 10. You're watching the Africa Leadership Dialogues. I am Julie Gichuru. Tonight on the show, we host Dr. Teguest Guerma, a woman who has incredible experience in healthcare across the African continent and globally as well. Dr. Guerma is the Director General of AMREF, an international non-governmental organization working in health development. AMREF's vision is a lasting health change in Africa through the transformation of communities from within. Now, prior to that, she was the Associate Director and later the Acting Director of the Global HIV and AIDS Department in WHO Geneva. Dr. Guerma has over 26 years' experience in public health, from which 21 years is with WHO. She has an extensive experience at country, regional, and global level in Africa, Asia, Europe, and the US. She served as the WHO Africa representative to the UN headquarters in New York and the WHO representative in Nepal and Botswana. Dr. Guerma co-led the WHO 3x5 initiative, which made antiretroviral treatment available to developing countries, and she also led the revision of the WHO ARV treatment guidelines, which recommended an early start of AIDS treatment for developing countries. Dr. Guerma has also served as a commissioner in the UN Commission on Life-Saving Commodities for Women and Children. Let's get her insights into Africa. Thank you so much, Dr. Guerma, for joining us on the Africa Leadership Dialogues. It's a great pleasure to have you with us. Now, your experience in work across the continent and globally as well it's really amazing. But you also, as an African, have lived in many parts of the continent. I want to begin there. What do you think is the state of the African continent today? What are your candid thoughts?
I really feel that it is a time for Africa. You've seen it everywhere. Africa is on the rise. It's economical growth for Africa. The future of Africa is bright, and I'm very, very pleased that I am at this right time in Africa to contribute to this growth and to this development. So Africa should not miss the boat at this time. We should make it happen and should be developed.
It's great to start on an optimistic note, and especially because you are in the health sector where it seems we have quite a few challenges still that we're dealing with. Before we come to that focus, you started your medical career in Burundi, interestingly enough, although you are an Ethiopian. And you know, we do still see conflict in many of our African nations. And the big question is, as some are powering ahead, others seem to be stuck in constant conflict. Why is this? What do you think the problem is?
You know, all the continents have gone through conflict. Africa needs good leadership, and its leadership is improving. Many countries in Africa are having leaders who are democratically elected, and democracy is improving in Africa, and I think in that way also we're making progress. But when Africa became independent, it's only 50 years ago, you know, we still have time to do better, but I think there is progress. I'm a very optimistic on this.
which is a good thing, which is a good thing. So what you're saying is, look, this is evolution. This is what happens in society. And we are going through the processes that many other continents have already gone through. Looking at Ethiopia, This is your home, although I'm sure you have many across Africa. This is your first home, and it's plowing ahead in terms of development, economic development particularly. Still some issues about transparency and the ability to, the democratic space, let me put it that way. What are your thoughts on where Ethiopia is right now?
Ethiopia is developing, and we are very happy that it's going on the right way. We are also learning on many sides, but there are positions that have been taken by, governments that has to be respected. Malaysia, South Korea, China, they didn't have democracy when they developed. Mm-hmm. What I want to see in Africa is the poorest of the poor getting good health, the poorest of the poor getting good education, the poorest of the poor getting food every day. Mm-hmm. That's where we will say that the inequalities in Africa has disappeared, and we can now say you have developed.
We're moving ahead, yeah. Once we've raised the standard of living for all and for the majority, exactly, who many of whom are poor. Insecurity, right from west to east, we're seeing rising insecurity across the continent, impacting so much on the ability of the people to feel confident, of businesses to stay and to operate in environments feeling secure. What are your thoughts on the situation?
I think for me, insecurity comes with poverty. If people are not poor, security will come. There are many other issues, but I really consider that poverty alleviation is the first thing to do to have good security in the countries.
The answer to poverty alleviation, I think Bill Gates recently spoke somewhere and he said, we have to be ambitious.
Yes, he said eradication, I heard it.
He said, we have to be ambitious. We have to just say we're getting rid of poverty.
Yes.
Can we, Teguest? Can we do it?
We can. We need to have our African solution for African problems, and also invest in health and education, and we can get there. But we really need to think for ourselves, to be really innovative, and to really think African. What's our problem? How can we solve it?
Are we doing it? And let's just look at this from two levels. There's the leadership level, but the citizenry level as well. What's your observation?
We're not empowered enough. We need to be empowered. We need to empower the communities. Communities know what they need. If we had started by them and by asking them what is their need, how can they make it happen, and empower them slowly with respect, and then they could really transform from within and they can make things happen. I really believe in community empowerment, and that is the only way of developing Africa.
This is what you mean by local solutions. Yes. Engage with the population at the grassroots level and then empower them to solve their problems. Let's come to AMREF because, I think that is part of the AMREF, model, which is work at community level, empower at community level. And I'm engaged and a huge supporter of AMREF because of Stand Up for African Mothers, which of course is training 15,000 midwives across the East African region. What are you most proud of in terms of the work that you're doing with communities in AMREF?
It's first of all our expertise in communities. Let's first give you an example. In many communities, female genital mutilation is the rule. Every woman has to go through that, through cutting.
How prevalent is that still?
Wow, it's really highly prevalent in many countries, particularly in East Africa and also in some part of West Africa. It's still highly prevalent, although we have a law. The implementation and the enforcement of the law is not there. But the way AMREF has found to solve this problem, and this solution came from the communities itself. The time they do female genital cutting is also the initiation time.
Right.
We feel as African, initiation is important. It's part of our tradition, it's part of our culture, it is important. But what we don't want to happen is the cutting. So they have invented what they call the passage of rite. They do the whole ceremony of initiation, but they don't do the cutting. So this is now accepted in many communities in Kenya. So in the Maasai community and in Kajiado and many places, they are doing this. And we want to take this and multiply this in other communities where this is happening.
Retaining the value, but ensuring that the health and the safety of the individual is protected. Do we have enough people who understand how to change mindsets at cultural level in this way?
And that's what we do. Mm-hmm. We train community health workers.
Okay.
Among the community themselves, people they know, the leaders of that community that they are respecting, the mothers, the elders, we train them and we convince them. And once we train them, they will go and do some peer education. You know,
right.
they
right.
really convince their community what is good and what is not good. And that works. Because if you go and tell them things, we're different. They don't relate to us. They will not accept it. But if people who have grown in their own community, who live in their life, are coming to tell them things, they will listen.
So it's identifying the change agents who are able to have the impact and change mindsets. Let's talk about HIV/AIDS and change in Africa. How far have we really come in the fight against HIV and AIDS?
As someone who has been involved in this since the beginning mm-hmm. of the pandemic in Africa, in 1985, when I started practicing medicine in Burundi, I was the only infectious disease specialist in that hospital. It was a public hospital. People were coming and being diagnosed HIV positive. There was nothing to do. They would send them to me, and I was announcing death sentence to everyone. I used to do that 3 afternoons in the week. And when I finished that, I myself were very much depressed because there's nothing I can do. I'm a medical doctor. I'm there to heal. I'm there to bring solution, but I couldn't. Then we started the fight of having antiretroviral therapy for Africans. This has been a very long fight.
And you've been at the forefront
yes,
of that battle.
I have been at the forefront of that. Mm-hmm. And I am very happy today that at least 9 million people in developing world are receiving antiretroviral therapy. And today, you wouldn't even know who has HIV and who has not HIV. HIV has been transformed into a chronic disease. People can live with it. Of course, it's important to get the treatment to everybody who needs it, but we have already gone so far from the time where the West were getting treatment and Africans were dying like flies. And I'm very pleased that we have been able to achieve this.
Stay with the African Leadership Dialogues.
Moving forward, and you've been a leader in that area, let's come back to the issue of leadership and the continent. And just looking at African governments in general, more attention is now starting to be paid on issues such as health. You can see an attempt to say, here in Kenya, for instance, giving access to medical treatment to all pregnant women, and the focus on that. Trying to improve the clinics and hospitals. Big challenges still for many African governments, but do you think there is a renewed passion for providing services to the people from many of our governments?
If governments don't invest in health and education and take leadership in this, we will not make progress. Today, global health is changing every day. Yesterday it was HIV, Today is maternal and child health. Tomorrow it's going to be non-communicable diseases. We jump from one priority to another without achieving the first one.
I must ask you before you go on. Almost makes it sound as though it's what's fashionable. It's what's the order of the day. Is that what it is?
It's almost like this, because the global community, really want to touch to everything, but without really finishing the started agenda. Right. There is an unfinished agenda, and they go from one way to another. What is the African agenda? What are the health issues that are priority for us? How can we, as African, invest into these priorities and develop the health of our communities? How can we, each individual, each African, contribute to our own health and stop dependency? For a long time, we've been dependent on grants, projects, this and that. But are we not rich enough to do something for our own people? We can't do something. Imagine if every African puts just 100 shilling. Let's not go very far, 100 shilling. All of us can do that. You see how many millions we can gather for health development and change the health in our continent and address our own priorities. But if we continue always receiving money from the West and having the dependency syndrome, and we will always address others' priorities, not our priorities.
Right.
So that's, for me, the most important leadership that our government should take. They should sit in the driver's seat, they should look at our priorities, and they should invest money. Abuja Declaration. Yes. We said that we will have 15% from all national budgeted for health. How many countries have done it? Maybe now 8, 9. There were 4 1 year ago, but I think now there were 8, 9. We haven't done it. We need to do it. How much money are we putting for education? If we are really serious about developing our continent, we need to walk our talk, and we need to put something on the table. But it's not only the government, also other partners, civil society organizations, private sectors, all stakeholders in a country should work hand in hand and develop the health and education of that country. I think that's the way to go, and I think we are on the right track, because I see the African Union doing that, the African Development Bank doing this thing, and Africans are now meeting among themselves and saying, what can we do together? I was also participating in the African CEO meeting 2 weeks ago, and the discussion was, how can we invest in social issues? How can we help develop our continent? We have started talking, and this needs to continue and achieve our objective.
What a powerful message for all stakeholders, leadership, African leadership, but also private sector and the citizenry as well. Thank you for that. Let's come back to the overview and the continent as it stands right now. What do you think are the greatest challenges facing Africa at the moment?
Poverty, inequality. You know, most of the population are now coming to live in towns, so slums, inequalities, and a lot of poverty in our capitals and big towns. That is the biggest problem we're going to face. Unemployment of the young people. Africa has a young population, and unemployment of the young people is going to be a problem. We need to create employment for our people. We need to do manufacturing. You know, if we are only exporting our raw material to the external world, we will never be developed. We need to manufacture and process our raw materials ourselves, oil and other things. So we need to empower our people, those who have money, into manufacturing and really processing raw materials locally.
So poverty, inequality, opportunity, creating those opportunities through growing our sectors such as manufacturing and managing our cities is critical. Let's go to the greatest opportunities you see in Africa right now.
We're now really on the right side of everybody's eyes. I don't know if everyone wants to invest in our continent because our economy is growing and the West is going through economical crisis, but it's really the right time for Africa. We need to use this opportunity. We need to really have social investment from all the businesses that are coming to invest in Africa. We also need to empower our own business people and to invest into Africa. But if we come back to health issues, because this is my expertise, and I don't want to spread myself into other things, it is really very important for Africa to invest into its civil society organizations. One thing in Africa, non-governmental organizations, civil society organizations, are seen as enemies of the government. They are not. They are partners, they are stakeholders. They should not be always activists, but they should also provide service. They should work hand in hand with the government for development. And the African government needs also to invest into their civil society organization. Like the West has done it. That's the way they used to invest into, they still invest into their civil society organization because they want them to play their agenda. So if African government wants us to provide the services to address the priorities that they want us to address, they need to invest into us. We need to build the capacity of those who have no capacity. The briefcase NGOs, we need to build their capacities. We need to teach them how to account. We need to teach them how to manage. And it's only that way, when we all work together, and when we are not divided, that things will happen. But we also need to exchange experiences between African countries. We need to have first free movement. Why is it that an American or a British can come to Africa and have a visa at the airport, and an African can go to a country and cannot have a visa at the airport? Can an African not be a tourist? Can't we have, respect each other and have free movement within our countries? We need to have integration. We need to have free trade between the countries, because it's only when we are united that we can develop.
Open up the borders, you say, and so many people have told stories of the struggle to move from Ethiopia to Tanzania, just seeking a visa. It's absolutely ridiculous. Again, on this show, we're saying to African leaders, please treat this as a priority. There are many business people across this continent trying to do business together, tourists as well, and well-meaning Africans struggling to get into neighboring countries. So let's address that issue before we close, and we're close to the end of the show. Paint your picture for us. What is the ideal Africa for you? What is the possibility of a great Africa?
A united Africa, a healthy Africa, educated Africa, and Africa which is doing trade among itself, and Africa which collaborate, exchange experiences between us and economically developed Africa.
For all the people watching who are saying, what's my role in moving Africa forward? What place do I have in this narrative? Please look into the camera and give them your message. What can we as individuals do to transform Africa?
Every African should have ownership and should work hard and should contribute without corruption to this continent. Hard working. This continent needs hard workers. This continent needs honest workers. This continent needs to put a little bit out of our pocket and put on the table to help the poor and get our brothers and sisters who are poor, the poorest of the poor and the most vulnerable, to our level. We need all of us to put our hand into the work and do things ourselves. Let's not expect governments to do everything for us. We are responsible for this government. We can make it happen. And I'm sure if all of us get involved, we will make it happen.
Thank you. Great pleasure.
Thank you very much.
Stay with the Africa Leadership Dialogues.
I'm Dr. Teguest Guerma. I'm the Director General of AMREF. You're watching African Leadership Dialogue.
What a fascinating interview. I particularly love the notion that in working together, we can raise this continent. It's not always about conflict and competition. It should be about cooperation. But now let's get your views on the issues.
This week we asked you, what are the key health concerns that Africa should focus on? Hithuku James Kinyanjui says, making healthcare affordable and accessible is of overwhelming importance. Infrastructure development, adequate medical supplies, effective and efficient human resource and integrated health insurance are key areas to work on. Michael Mtux says, providing efficient, readily available, accessible and affordable medical facilities and services to her people.
Hi, my name is Andrew Mutuku, watching Africa Leadership Dialogues from Kitui. I think Africa should focus on 6 priority areas for intervention: HIV/AIDS and tuberculosis, malaria, safe water and environmental sanitation, family health, clinical outreach, and disaster management and emergency and response.
To join our conversation, go to our G+ page, Africa Leadership Dialogues, on Facebook, Africa Leadership Dialogues, on Twitter, @AfricaLD, and on WhatsApp, send your video comments to +254 715 816 033.
Thank you for sharing your views. Keep them coming in. Let's keep the conversation going. Now, Africa's Top 10.
On Africa's Top 10 this week, we look at non-governmental organizations and community health organizations in Africa. This is according to African Studies Center. Starting us off at number 10 is the East Africa Network for Trypanosomiasis. Eastern Africa Network for Trypanosomiasis aims at establishing collaboration in research, training and control of trypanosomiasis. Coming in at number 9 is Center for African Family Studies, CAFS. CAFS is an African institution dedicated to strengthening the capacities of organizations and individuals working in the field of reproductive health, population and development in order to contribute to improving the quality of life of families in sub-Saharan Africa. Positioned at number 8 is Africa Action, Africa's Right to Health campaign. Africa Action initiated the Africa's Right to Health campaign to address the HIV/AIDS pandemic and the broader structural problems that have driven its spread on the African continent. At number 7 is the Africa Center for Health and Population Studies. The Africa Center for Health and Population Studies focuses on demographic research related to health and aims to advance scientists' understanding of rural African health behaviors, lives and society. The African Population and Health Research Center, APHRC, comes in at number 6. APHRC is a non-profit NGO headquartered in Kenya and staffed by an international team of African scientists that is committed to conducting high-quality, policy-relevant research on the population and health-related issues facing sub-Saharan Africa in the next century. Slotted in at number 5 is the Africa Regional Sexuality Resource Center, which is part of a Ford Foundation grant-making initiative, Global Dialogue of Sexual Health and Well-being. The center aims at giving visibility, depth and legitimacy to the field of sexuality by creating mechanisms for learning at the regional level. Global Alliance for Africa comes in at number 4. It was established by a group of healthcare professionals and other concerned individuals in order to support self-sustaining, community-based approaches to healthcare, specifically in maternal and child health. Taking the number 3 spot is KABISA, African Civil Society Contact Directory. KABISA is a non-profit organization dedicated to empowering African civil society organizations to use information and communication technology effectively for the benefit of their communities. Coming in at number 2 is Equinet, the regional network on equity in health in Southern Africa. Equinet is an African-based network of professionals, civil society members, policy makers, state officials, and others within the region who have come together to promote and realize shared values of equity and social justice in health. And at number 1 this week is the African Medical and Research Foundation, AMREF. AMREF is an independent non-profit, non-governmental organization whose mission is to improve the health of disadvantaged people in Africa as a means for them to escape poverty and improve the quality of their lives. AMREF has defined 6 priority areas for intervention: HIV, AIDS and tuberculosis, malaria, safe water and environmental sanitation, family health, clinical outreach, disaster management and emergency and response. And that's Africa's Top 10 this week.
So quickly we've come to the close of the show, and we end tonight with a Nigerian proverb. And it goes, "In the moment of crisis, the wise build bridges and the foolish build dams." Perhaps it's time for us to take a moment and ask ourselves, what are we building in our lives? Are we building bridges or dams? Blessings to you and blessings to Africa.